This segment of DelmarvaLife is brought to you by Peninsula Home Care.
Congestive heart failure affects more than 5 million Americans. And although the term uses the word failure, it shouldn't be confused with a sudden malfunction that threatens your life.
Congestive heart failure is serious. It, however, can be managed. And here to tell us more about it, from Peninsula Home Care, Jessica Lewis and Christopher McLean, both are clinical managers of care coordination. Thank you guys for joining us.
Thank you for having us.
Yeah.
So tell me exactly, what does it mean when they say you've got congestive heart failure?
So when a patient's diagnosed with congestive heart failure, it just means that their heart, what is the muscle, is weakened. So it doesn't allow the blood to flow properly, so it causes them to retain fluid.
So what are some of the signs or symptoms of congestive heart failure?
Lower leg edema, swelling, shortness of breath, increased heart rate. Chest pain can come with it, but that's, more when it's on a serious, like probably should go to the hospital.
Sure, yeah.
So if you wind up with congestive heart failure, can this impact other diagnoses that you may already have?
Yeah, absolutely. So congestive heart failure, along with other like diabetes and like that, it affects everything within your body. Congestive heart failure is the thing that, your heart does pump your blood. So if that muscle is weakened, it can exacerbate other symptoms or other diagnoses that you do have.
Wow.
Okay. So what does Peninsula Home Care do for patients with congestive heart failure?
So a lot of things that we do now is, we actually supply equipment to the patients and we teach them how to use it. The olden days, we'd hire somebody and they would come bring all this equipment to the house and they'd be hooked up to, a cellular device or something like that. We have found that in this community, a lot of people don't have cellular activity. So they'll get up in the morning, they'll take their blood pressure and jump on a scale and do what they're supposed to do, but that information would never get transmitted anywhere.
Right.
So there'd be hours and hours and hours and they get a phone call from somebody that would say, hey, where's your information? And I'm like, well, we did it, but it would never got transmitted. So something that we have embodied as a company is we're going to give you the supplies. We're going to teach you how to use it so you can self-monitor.
So what should we monitor? You mentioned weight, you mentioned blood pressure, pulse ox.
So your oxygen level is the pulse ox.
Right.
So if you're short of breath, it'll be lower. Your blood pressure, you want to monitor it that it's stable where it normally is for you. Weight, you always check your weight. The best time of the day is when you first get up after you've used the bathroom. Step on the scale, check it, and the least amount of clothes that you can. That way it's a more accurate weight. If you have a weight gain of greater than 2 to 3 pounds in a 24-hour period or 5 pounds in a week, you need to be calling. We educate our patients to call us or the cardiologist.
Okay.
Because that could indicate swelling.
That their fluid is backing up and they need maybe an additional medication. That's what we try to prevent is hospitalization. So if we can just call the doctor, help them get a little bit more medication, like Lasix, to pull off the extra fluid, that's what we would do.
Okay, and this notebook here comes along with it, and everything that they need to know and all of the records they need to keep are done with that?
Yep, it has information in it, it has a log, it has diet education because a lot of our patients eat a lot of canned foods, and so providing the education that they're higher in sodium, and sodium causes you to retain fluid.
Yeah.
So there's diet education, there's just what CHF is and how to log your vital signs and when to call us and on the front of it.
That's amazing.
That's great.
Yep. Okay, and of course, monitoring is important, education is important. You guys make it easy, right?
Yeah, we do. I mean, we really, something that we have embodied here at Peninsula Home Care, we really, drill down on the basics of cognitive behavior. We teach people to be well. No one ever wants to be sick.
Yeah.
Jessica, Christopher, thank you so much.
Thank you. Thank you.